And I'm Linda Carson, the first doctor in Florida to implant a telescope in the human eye is from Sarasota, and he's right here, and we'll find out that he is offering hope to people who are losing their vision. All that and more right now on Suncoast View. Welcome back. Our next guest is the first doctor in Florida to implant a telescope in the human eye. Please welcome Dr. Mark Levy, a Sarasota-based specialist in neuro-ophthalmology and orbital surgery, and also the ophthalmologist to the Tampa Bay Rays. Welcome to our show, Dr. Levy. Now, you do this for patients who have macular degeneration.
Yes, but actually, before we talk about what patients see with macular degeneration, we should mention that it's the most common cause of visual loss in patients over the age of 60. Wow. In America alone, there are 20 million Americans that have some form of macular degeneration.
Let's take a look at the video that shows us what a normal person sees. Okay, this is all right. This is what a normal person sees.
Sure. So with patients with macular degeneration, they get a blind spot in the center part of their vision. Now, this is it.
This is macular degeneration right here, right?
That's correct. So now there's a telescopic implant that can be placed in certain patients with macular degeneration.
And this is what they see?
And that will shrink their blind spot to 1/3 the size.
Oh, so that's normal.
And it magnifies their vision up to 3 times.
Macular degeneration?
Correct.
And then this is coming up with the telescope.
That's correct.
Oh, my. So you came up with this in Florida. You started this, right?
We actually did the FDA trial here in Sarasota between 2002 and 2004. We did 5 patients in the state of Florida.
Now, that's what it looks like? That's what the telescope looks like?
That's what it looks like. And actually, I have one here for you, Linda, to show you.
Wow, look at that. Wait, that's it right in there?
It's teeny tiny. It's not.
Well, I think I closed the wrong eye.
It's actually the size of a pea. It's much smaller.
Look at that, Joey.
I
think you're not really supposed to look
something
through
you
it.
feel once it's implanted in your lens?
No, it actually goes inside the eye where the human lens was, and you don't feel it. It takes about an hour, and it's an outpatient procedure.
Wow.
How long will it last?
It'll last their lifetime.
Oh, so do they have to keep having replacements or anything?
No, it's only FDA approved. It recently was approved for 75 years or older, and the FDA minimized the age to 65 years this past January.
Is it certain types of macular degeneration?
Yeah, because this isn't for everybody.
That's correct. There's 2 forms of macular degeneration, the dry form and the wet form. In the wet form, new blood vessels would grow underneath the retina, and all we could do is either treat with laser or with injections. The dry form is the much more common form. It occurs in 95% of cases with macular degeneration. Previously, up to this implant, we had nothing to offer them except vitamins and come back and see me in 6 months.
How heartbreaking.
What causes macular degeneration?
Well, actually, there's some risk factors for development of macular degeneration. One, if your parents had macular degeneration, you're likely to have that gene. Number 2 is vitamins. And number 3, risk factors, not having vitamins, is eating correctly and smoking and indiscriminate sun use.
This is an example of the eye.
This is an example of what people with macular degeneration have. They have a scarring in the center part of their vision or the retina. As you can see there, they can't see the balloon. The blind spot takes the place in macular degeneration, and it prevents them from seeing. So it's as if you have a fist or a blind spot in front of your vision. This is the wet form right here. So now a telescopic implant can be placed, which you see here.
This is a little telescope.
The telescope. It's a high plus, high minus lens, and it goes inside the eye and magnifies 3 times. So the blind spot gets minimized, and actually we can now see around it.
Does it hurt?
It does not. It goes where the human lens is. As I mentioned, it's about a 1-hour procedure. It's outpatient, and the patients can start regaining their vision within a day.
That's amazing.
Can you actually see the lens once you look at a person that has it?
You cannot. So it doesn't really carry the same stigmata who's wearing magnifying lenses or glasses. You can't really tell now that the patients have macular degeneration.
My. Do you have any tips for us?
Well, there's a couple tips. Number one, anybody who's taking care of somebody with macular degeneration, you want to make sure that they're seeing their eye professional, that they're seeing their MD ophthalmologist. Because like anything, we want to diagnose this very early. There's an old saying, anybody can diagnose pregnancy when the baby's coming out, but it's a little bit late by then. We want to see these patients early on because we may be able to minimize their disease.
So you should have an eye test every
Yes.
Well, let's give Bo Beth an eye test.
I knew this was coming.
So, Bo,
I
put
don't
this over
understand why you guys like to put me on the spot.
Put this.
You're
I want
young.
you to
You're the one that
read
can see the best.
smallest line you can see.
Jeez Louise.
Let's start with the top line.
Can you see the top
I
side?
can see the top line. I can see COHZV. Okay, the small. Stop moving it. I'm not sure.
Holy moly, Boba.
BRND.
Where is she?
Does that one exist?
Where are you?
that's
It's
good.
the third
very
one from the
good.
bottom.
Did you check the other eye?
Oh God. All right. I'm a lot further up on the line. I can see KCRHN on that one. Stop it!
Here's my card. I'd like
Seriously.
Centrosite.com. You can get more information. Go to centrosite.com. Right, Dr. Levy?
That's correct.
Thank you so much.
Congratulations.
My pleasure.
This is
Today.
It's a wonderful
A wonderful
development.
breakthrough that is. And, of course, I know you know this person
She's fabulous.
well.
Yes.
We'll be right back. Thank you so much.